Hi, everyone. Welcome to week 8 of HPConnects. I'm so excited to have two guests on this afternoon to talk about post-COVID workspace and what that's going to look like. Jason Costello and Tim Bailey of Margulies Perruzzi will be here to join us, are here to join us. Gentlemen, whenever you are ready, you can unmute yourselves and show your video. So guys, welcome.
Thank you for having us.
Absolutely. I am going to hand over the microphone to you.
So thanks everyone for joining. We would like to take you through some of the research that we've done at Margulies Perruzzi since the very beginning of this pandemic. We followed, the entire process from the very beginning through today and are trying to forecast what does the future of the workplace look like and what does this recovery look like as we move forward. To take you back a little bit, we've done a lot of webinars. We've been participating in AIA task force. We've done a lot of surveys. So we're really reaching out to our clients, OPMs, brokers to really understand, what are people's concerns and how can we help people in the return to the workplace. And we've done, this is actually one of the surveys that we had done as part of our workplace report that actually we will send out to you after this webinar. So we surveyed about 500 of our current clients, owners, project managers, and brokers to see what are people most excited about returning to the workplace. And obviously, 90% say it's really that collaboration with people again. And I think that's the one thing that everybody is missing at this point. But we also asked you, what are your concerns? What concerns you about going to the workplace? The safety within the common spaces. How are you going to keep those spaces clean so people don't worry about, contracting any virus? Air quality, but also as we go back to the office, the video conferencing tools, providing tools not only in the office, but providing tools for people that continue to work from home as we move forward. So that they're able to join these meetings and be able to participate effectively. And what are the most important to the workplace when you return? And I think everyone can agree, whether you're in the workplace or at home, having a space to concentrate is number one. Whether you're at the office and now the new normal is you're going to be having Zoom meetings at the office, and trying to deal with that in a way to make sure that you still have that space to concentrate. Interestingly enough, 73% of the people that we surveyed said that they can manage their teams remotely, and that was kind of a shocking number as we were going into this pandemic, because no one really knew how effective people were going to be working from home. Early on, this is probably about a month and a half ago, what we did is we started to identify for our clients certain steps that you can take. Step one, identifying that low-hanging fruit. What are things that can be done now to prepare for the workplace? And a lot of our clients are actually doing a lot of these topics, but as you look at step three, thinking about the future, what does the future of the workplace look like? And these are things that would take a lot more capital and a lot more investment to do. So rightfully so, we're helping our clients really study the pros and cons of these different initiatives. And one thing we've also done is we have surveyed our own company, and we've tried to understand what people's concerns, and we've gathered a lot of feedback on how we can actually return to work ourselves. And Jason was instrumental in putting this survey together. Jason, do you want to briefly talk about this?
Yeah, so as a part of our reactivation process, we really wanted to understand what our employees' concerns were and really understand that so that we could prepare the appropriate kind of work procedures and office policies to make people more comfortable in coming back to the workplace. Immediately, I think a big concern has been around commuting. That 18% is probably actually a lot closer to 50% because we've seen a migration people away from the MBTA as being a serious concern for places that they could get sick and have seen kind of the people who used to take the MBTA, which was 60%, has shifted with people who drive. And so we've seen that flip-flop, and driving is now the 60% of how our teams are planning to get to the office 1 or 2 days a week, because that is a significant concern of exposure to the virus and getting sick on their commutes. Once they're in the office, there was, 82% of our office was neutral or comfortable or very comfortable in coming back. I think there is, an interest in reconnecting with some of the people that we work with and seeing some faces. And to tell you the God's honest truth, kind of just getting out of the rooms we've been working in for the past, 70 days, I believe is the count we're on, for 70 days from working from home. So, and looking at the other concerns, there's a concern about getting exposed to COVID in the workplace, but there's actually also a broader concern of employees didn't want to get their coworkers sick. And so there was a big concern about getting other people sick if for some reason you were sick and you didn't know about it, and making sure that we were taking the appropriate precautions in the office to kind of help minimize that risk. And then, as Tim mentioned, Zoom meetings are a part of our days now. So, how do I have this same call or this same conference in an open work environment? And do we have enough of those spaces to be able to take these out of the open workplace into conference rooms, to be able to support this kind of collaboration without impacting our coworkers around us, and making sure everybody's productive in a kind of effective work environment. Some challenges come up. I mean, obviously we're all kind of adopting to working from home, but 3 big challenges that kind of we learned from this survey was, the work-life balance. Now that you have access to work at home, it's very difficult sometimes to turn it off. And so people are finding themselves working more, kind of spending more time on their computer with their emails, and kind of having a hard time unplugging. And then also managing the distractions at the home office. I currently have in my hallway a no-fly zone posted for my son, who's 10, to make sure we don't have any feet come hauling down the hallway during this conference. So managing those distractions, and even managing the care for our kids and other people that depend on us, that there aren't those other kind of school and day programs to help parents out managing those commitments. Collaboration's a big one. I think Tim could tell you stories about how we've adopted that in our creative team environments around architecture and technology, and the new softwares we're using to be able to communicate graphically and with the, with our clients, the design process, and engaging them in that via virtual meetings and via Zoom. And we're still plagued by some of the technology things. Yesterday was a bad internet day for me. I was scared about this conference and being able to present today. Internet connection speeds can be highly variable in the residential neighborhoods, and depending on which communities you're a part of, that can be a big problem for being productive and being able to participate and engage on some of these type learning opportunities. And then for us, double monitors is king. Being architects and designers, we rely on 2 monitors heavily. So having our teams kind of have to go back home, bringing both those monitors, some people brought both monitors to their home and are set up for that out home. And there are challenges with now having to maintain 2 workplaces. So, do you want your 2 monitors for the 1 day a week that you're going to be in the office, or do you want your 2 monitors for the other 4 days a week when you're kind of working from home?
So in the return to work protocols, where do we go from here? So a lot of companies are setting up the protocols now, whether they actually have people going to the office now or not. And here's just an example of how we did it for our office. Taking a look at the social distancing, making sure that everyone is really separate. We're actually going into, we're doing a 4-day, 5-day shift. So we're only doing certain people. You can see in the color-coded plan. So for example, the green color are people that will only be in on Wednesdays. And this graphically shows that people will be separate. So I think people have a good feeling knowing that, we're not only adhering to the minimum social distancing regulations, we're going above and beyond to ensure that people really are separate from each other. And it's a lot of behavioral, learning objectives that have to happen, posting signage just to remind people of the new protocols that are going to be in place. Obviously the workplace is not going to be the same workplace that everyone left, and it's going to take a lot of, reminders so people don't fall into the same habits of before the pandemic. Putting together daily questionnaires. I know a lot of building owners are putting together, whether they're doing temperature screening or not at the front door, they're putting together a list of questionnaires for every person that comes into the office. And if they don't, successfully answer all these questions, they may not be able to enter into the workplace. And that's for everyone's safety. Just reminding people to wash their hands. That's still the number one thing that people can do to maintain safety in the workplace. And Jason will have a slide coming up in the presentation that's a staggering look on how effective washing your hands actually is. And so determining the max occupancy for your space. So phase one was limited to 25% occupancy returning to the workplace. So there's a few different ways to calculate your occupancy. You can start with actual, building code. So if you still have the, the drawings from your current office space, you can see your occupancy numbers on those drawing sets. However, I think what you'll find is by doing, 25% of that is still going to be too many people, and you really have to look at it from that plan view that I was showing earlier to really visually see that everyone is socially distant. So you're actually probably going to want to take the 25% of your actual occupancy, not your allowable occupancy. And we have some additional slides. So for training rooms, for example, where there's a posted occupancy, a lot of training rooms will have, a max 50 people. So making sure that you take those rooms into account as well as part of that occupancy calculation. So as you can see, by building code for a business occupancy, you allocate 100 square feet per person in a business class. But a lot of companies, just based on the numbers, are well over 150, 200 square feet per person. So that's why looking at that actual occupancy is key to maintaining that social distance. And so here's a planned example of doing that 25% occupancy. And the circles should show up. There you go. So this actually shows that 25% occupancy. And this is actually just a reminder that this is just for phase one. So as people are starting to go back, and you can see how distant those people are. The orange circles are a 12-foot radius. So that's above and beyond, the 6-foot social distancing. That really ensures very, effectively that people are going to be quite distant from each other. And as, right now we're in phase 2 in Massachusetts. So as we go from phase 2 to phase 3, like you can see, for example, you can still get other people in the office and still maintain that social distancing. So as people get more and more comfortable returning to the workplace, there is an effective way to utilize the space and still maintain that social distance. So what are tenants doing? The number one thing is a lot of tenants, a lot of clients that we're working with, don't have people going back to the office at this point. Some of them aren't even having their employees, unless they're essential, go back until the new year. So one of the number one things that some companies are doing is, alluding to what Jason was saying earlier with technology, is people that don't have the technology at home, they're actually sending them, care packages basically to get them so they can, effectively communicate with everyone else in the office. And there's an example on the right of, one company that's providing that for all employees. Providing, testing, contact tracing. We have one client that's gonna test their employees that are in the office every 4 days. And that is an extreme example, but testing is going to be something that, people are gonna see when they return to the workplace. Closing the common areas. So for us in particular, the kitchen is off limits. No one's using the shared refrigerator. If the coffee maker is used, it has to be wiped down after every instance. And a lot of the larger companies we're working with are actually having baristas come in. So people don't actually touch it. They just go and pick up their coffee and then they go to their their workspace. And staggering arrivals and departures during the workday will help take some of the heat off of the elevators, which is always a concern going back to the workplace, minimizing the queue in the main lobbies, so people aren't waiting in line for quite a while to get up into the space. And so in turn, what are the landlords doing? So a lot of landlords, luckily, when this pandemic first started, I think there was there was a little bit of a panic mode that luckily has subsided a little bit. Not everyone ran out and put automatic door openers on all of their doors, and tenants didn't rush out and start building all these private offices that we worked so hard to get rid of over the last 5-10 years. But there are a lot of things that they are doing. So they're increasing their security to be able to keep doors open and keep them touch free, allowing people to use the egress stairs to travel vertically in the buildings to take some of the pressure off of the elevators. Limiting people in restrooms. In our particular example, we're only allowing 2 people in each restroom. And then there's proper signage, and then they've closed off certain parts of the restroom so they're not able to be used. And also HVAC filtration upgrades, and Jason's going to talk a little bit about this later, but there are certain things with filtration of your HVAC systems that you can do on a scale to increase how much particulate matter is taken out of the air that you're breathing. And so as we look towards the future, what does the workplace look like? I've had a lot of clients ask me, do I keep the same amount of space? Do I cut my office space in half? Do I need more space? And the answer is it's actually kind of tricky because you can see in the graph what we've done is 2020 Q1 before the pandemic, a number for the trending workplace is about 125 square feet per seat. And 125 square feet per seat is pretty aggressive. So now you can see in phase 1, we're at about 250 square feet per seat, and that kind of goes back to the, to the plan that I was showing earlier. But what does phase 2, what does phase 3 look like moving forward? So an example in the upper corner. So if you had 150 people in your office pre-pandemic, and you had about 18,000 square feet, you're now like at 37 people at 400 square feet per person. But looking in the future, you really have to balance between how much of the percentage of staff do you actually need in the office space moving forward, because if you at some point after the pandemic is over or there's a vaccine, if you still need 100% of the staff in the space and you still want to maintain social distancing, you're actually probably going to have to increase your square footage. And you can see this near term, if you only need 50% of your staff, for example, to be in the office space, you can safely distance people at about 250 square feet per person and maintain the same amount of square footage. But beyond the 50%, it starts to get a little tricky in terms of how you still maintain a social distance in the office space with the percentage of people that you want to have there. So I'm going to turn it over to Jason again. So Jason leads our healthcare studio at Margulies Perruzzi, and I think there's a lot of lessons that the corporate world can learn from how things are done in healthcare and how we can apply some of those initiatives to the workplace. Jason?
I think there's a question, so
Yeah.
pause for a second.
Oh yeah, I was going to say, so it looks like, what about the employees that may not have the space at home to continue working from home? I think we talked about this yesterday, guys. And do you find that they're anxious to get back into the office to actually have space to work?
Oh, absolutely. I mean, that's, whether it's technology or whether, you're under 35, and there's 5 people living in an apartment in Brighton sort of situation where, it's impossible to concentrate. So, I mean, we are seeing a lot of it's not just, what people need to go to work to actually get their job done. People psychologically, they need to be able to get out of their houses at times to maintain that social, well-being and their own sanity to be able to work effectively.
Yeah.
And I think that's going to be a long-term kind of question as we look, companies begin to evaluate, their remote work policies and how much space do they need in the future, is balancing those kind of the financial incentives of downsizing their offices and, kind of using this as an example or a reason to push more remote work for those capital savings, and their ability to recruit and retain talent. So, we saw this with the big push to come into the city, right up until COVID. Technology companies were moving downtown because that's where the young up and coming talent wanted to be, and they wanted to live, work, and play in the city. And a big part of that is that social connectivity of in-person interactions. I know there's a lot of talk about the internet or the thumb generation of just being on their phones, but they want those connections. They want those in-person interactions. And I think that is probably kind of the biggest thing that is missing from the remote work. Across all
there was actually, there was a really good article that I read from Forbes, I believe it was on Sunday, talking about why it's absolutely necessary to have the workspace. You can't totally abandon it, post-COVID. And, and that's exactly, one of the things, having that humanity, the innovation, the health and well-being of people. That's why the workplace is still needed moving forward, along with the talent, engagement, all of those things that the office still does bring.
Yeah. There's another question. Do you have advice for classroom layouts in schools regarding square foot per student?
That's a tricky one. I mean, I focus mainly on the workplace. So I've only dabbled in classroom setups a little bit in my career, but Jason, do you have any experience with classroom?
I don't. I think I've been following this. I have an opinion. I'm gonna forgo sharing my opinion because it is probably one of the hottest topics right now of returning to schools in the fall, and the importance of getting kids re-engaged socially, and the economic impact it has on parents, particularly it's a problem that is the further kind of down the socioeconomic spectrum you go, the bigger problem it is for the people that really need to get back to work, because they don't have the financial stability to, defer their job. Their job is required to be in person and kind of find care for their kids. So that is going to be one of the biggest challenges and probably the biggest and most contested return to active kind of schooling. There are some great architects out there that are thinking about these things. I know I work very closely with Dorian Whittier on a school project down here in Scituate. And, there are some very smart people looking at this critically on how they go back. But, depending on, what phase we're in and what the current requirements are around social distancing and, getting kids to social distance, that's another whole kind of so I'm going to defer on that question, but it's definitely one of the more complicated ones.
And do you guys have an idea that this goes back to Tim, a previous slide? Do you have an idea of how many companies will choose to reduce their office staff compared to companies who will choose to expand their space to accommodate their staff? Do you guys have those stats? Yeah.
I mean, I think people are still in that, wait and see kind of mode.
Right.
People are waiting to see, what happens in the coming months with a potential vaccine. I don't see people necessarily running to reduce their square footage at this point. But in the next year, 2 years, I think that could be something that's on the table, depending on how many, what percentage of their employees actually need to be in the office at a given time. It's really rewriting the whole work from home policies for a lot of companies.
And I love the idea of what Margulies Perruzzi chose to do is to, certain folks come in on certain days, that's really smart. Because then, especially if you can plan out who it is, like if it's the marketing team or I was going to say estimating
Absolutely.
team.
Yeah.
Okay.
And I think too, we've been talking with brokers and landlords, building managers, trying to track some information on the sublease market. And we're really seeing, that pause. Companies, what we're hearing is that companies that were kind of in financial trouble before COVID are the companies that are really actively in that sublease market that have needed to get, their rent off of their books and help kind of defer or reallocate that cost. But companies that were in good kind of financial health going into the crisis have not kind of run to make significant real estate kind of investments either way, either expanding or expanding. And I think, real estate right now, in conversation with the brokers is some activity, the same activity. There's obviously less site visits, but I think the deals have fallen off, and it's just, waiting for things to kind of get a little bit more clear in the crystal ball before people are making those big financial moves.
Well said.
So healthcare, that's my corner of the world. I dabble in the workplace every once in a while. But, healthcare has been, we've been working on the forefronts of the COVID-19 pandemic. One of my partners, John Fowler, has been involved with one of the AIA's COVID task force around alternate care sites, burning the midnight oil very early on to get some guidance for how those are done safely. And then another member of our team, Bob Heumann, has been out working with our clients to understand regulatory implications on kind of COVID treatment sites and COVID testing to help our clients navigate that quickly and be able to get to market with these temporary spaces to meet the needs of the growing pandemic. Next slide, Tim. So, healthcare has been dealing with infection since, I think 1847, when infection really started to become a part of the conversation. And with every healthcare project inside the hospital, the project undergoes an infection control risk assessment, or an ICRA. And what that does is it allows us to evaluate, risk for infections to adjacent patients based on the type of construction we're doing, the at-risk level of the patients, and our proximity to them, so that we are able to kind of design and build these projects inside the active hospital without increasing the risk for patients to get sicker while at the hospital. And so when COVID hit, we saw an opportunity to take that design thinking that went on specific to healthcare and apply that to broader real estate practice of, helping clients and ourselves identify and categorize the risks that are present in the workplace, as we're considering going back. Really focus on the high levels of risk, and so implement countermeasures and do things to, address those risks and help minimize it. It's, as with everything, it's very difficult to completely eliminate the risk of infection, but what can we do to manage that? And then as, things change day to day, I feel like we're on an information plateau, kind of things have kind of settled out. I'm not, seeing a completely different change in, research and thoughts on managing infection risk right now. But as new information becomes available, or as we're able to move forward with the reactivation process, we need to revisit those things and adjust our plans to be able to continue to respond to the dynamic nature that is COVID-19. Next slide, Tim. So how we did that was introduce 8 categories of information from the CDC, from the state, from a variety of OSHA and federal and state guidelines to kind of highlight 8 risk factors that are prevalent in a non-essential workplace. And so those range from the ability to social distance or physical distance to how easily you can clean the space that's being used, to how people behave in those spaces, highly social spaces, spaces that have multiple or shared resources where multiple people are in there touching things and utilizing those to get their jobs done, and then assigning that a risk level. So if you go to the next slide, we can see kind of how that plans out. And by going space by space through an area, we can quickly identify, in our reactivation plan, how you where you need to spend your time and where you should be investing things, either through kind of limitations. As you can see, our kitchen is, you know, a hotbed of risk. It's small, it's highly social, you know, it's one way in, one way out, and there's a lot of things to touch and a lot of things to clean. So, you know, how we've managed that is we've, you know, shut down the refrigerators. We're looking to have cleaning materials at the coffee and water machines so that people can clean it before they use it, they can clean it after they use it, and then put an occupancy limit on the room so that there's actually only 2 people allowed in that room now at any time. And if you're there and there's 2 people already in there, we just ask that you stand outside and wait for somebody to leave so that you can, you know, maintain that social distancing. In addition to having your mask on anytime you're away from your desk in the office. And so going through that, we were able to kind of highlight where we needed to invest, you know, either changes to the physical environment or just policy and kind of behavioral changes to help minimize the chance of infection within the office. So if you go to the next slide, Tim. So as I mentioned, washing your hands has been around for 173 years since it was first identified as being one of the key contributors to spread of infectious disease. On the left is a very interesting graphic of how much stuff is on your hands prior to washing your hands, all the way through the different levels, from the rinse and shake to, you know, fully doing the double happy birthday, hand scrubbing goes on, and that incrementally you can see that decrease in potential contagions on the hands is pretty dramatic, and a picture's worth 1,000 words. Also love, you know, some really great and creative advertising from Asia on, you know, the importance of hand hygiene, and kind of humorous activities or humorous advertisements from.
Oh, I think there might be a slight delay on your end, Jason. Is that on my
that
end?
neck of the woods.
Yep,
Unfortunately, no, my internet connection is unstable.
You're back, and you're back.
Yeah. Okay. So I'll leave my tie jokes abroad, but nobody's talking about eliminating ties from the workplace, unfortunately, which I think would be a major step forward, particularly in healthcare again.
I agree.
So, but how has healthcare handled this? So healthcare has been, you know, again, super focused on hand hygiene and the introduction to antimicrobial surfaces. You know, as everybody's throwing antimicrobial and products at us, you know, it's important to remember, you know, there's a wide variety of products, and a lot of them are effective at very specific things. And the contagions fall into 2 kind of major categories: viral, which COVID-19 falls into, and then kind of bacterial and living microorganisms, where you run into with like C. diff or MRSA, which are 2 of our more challenging infections within the healthcare environment. So, you know, what you're looking to do is on those high touch points that can't be cleaned after every time somebody interacts with them, is to create a surface that, 1, does not contribute to the growth of for microbial growth, and 2, hopefully decreases it over time. So it has an ability to interact with viruses, in particular for our situation, and inactivate those viruses through a duration of time. Some of the new technologies, this nanoparticle technology that uses nanoparticle silver to inactivate viruses, and has been shown effective in kind of the 8 to 15 minute range of being able to neutralize virus. Historically, copper and silver have been other touch surfaces that have been used in water filtration and door hardware to kind of help control the growth and spread of contagions through those surfaces. So where you can't go touch-free, or it's not cost-effective, or it's really prohibitive from a scheduling standpoint, these are some other options that you can do to kind of address those high-touch surfaces. It's important that, you know, even in the healthcare market, those are combined with an enhanced cleaning practices. So it's not a silver bullet, if you'll excuse the pun, but it is combined with that ongoing cleaning regimen for the different facilities. Next slide, Tim. Another interesting technology that's been around for a while, particularly in the operating suite, is the use of UV, ultraviolet germicidal irradiation, another tongue twister, UVGI. that has been used to address bacterial and viral growth and contagions in the operating rooms. And obviously a high source or high risk of infection in those spaces. And so what it does is it uses ultraviolet light waves to basically kill viruses and bacteria. It's often, again, a part of an overall cleaning regimen, so it doesn't do it all itself, but it is combined with, you know, the physical cleaning. A couple of key notes on ultraviolet light is it's a health risk to humans, so kills a lot of things, including us. It's a source of cancer and cataracts. So any place you are using it, it does require the space to be unoccupied and certain safety precautions held in place. But we're seeing it, you know, as a great tool for with the portables, for wands to clean those difficult or hard to clean high touch spaces is another way as part of the cleaning regimen. And then, you know, through kind of stands and mobile stands that they can go and clean a room, or if there's an infection in a building, ability to come in and use that to, you know, address that and really clean the space. So next slide, Tim. Up until now, we've been talking about touch surfaces, but UV is also being used to inactivate and address microbial growth in the air as well. And so there's a couple of systems that are out there that might be used on kind of a short-term situation. One is upper air UV treatment. And so basically installing UV lights above the heads of all of the occupants, and it treats the air as the ducts are bringing air into the space at the diffusers as it's coming through, that's moving through that in, kind of sanitation zone down to the people, and then as it's being returned after it's been, you know, breathed and kind of sent back up, you know, it's getting treated as well as it's kind of moving back into the return duct system. An even better option potentially is the inside the duct unit or inside the mechanical units to kind of clean that air as it's not exposed to humans, or kind of a funny purple light at the top of your room. So, you know, the mechanical systems, there's been a lot of talk about this, and I think this is probably one of the biggest gray areas is how mechanical systems do or do not contribute to the spread of COVID. Just due to the novelty of it. I love ASHRAE. They, you know, very clear that HVAC systems cannot, through airflow control alone, kind of impact that. But in healthcare, again, we've been using pressurized spaces and kind of positive pressure to protect people from infectious disease, negative pressure to kind of isolate people who have those diseases so that they're not getting more people sick. And so there are some ideas around that you could temporarily negative pressurize lobbies and communal spaces through temporary conditions to exhaust those spaces so that you're not getting a lot of recirculated air. And, you know, increased filtration, Tim mentioned that before. That's another one to try to remove as much of the COVID virus particles from the air as it's being heated and cooled so that, you know, you're reducing that particle count, which is a big part of how infection spreads, is a quantity of the virus. So anything you can do to knock that down. All of these things have pluses and minuses. So we have some great engineers in Boston that can do a much better job explaining this. But I think the gist is anytime you're looking to make changes to that, you got to make sure that the mechanical systems are able to accommodate that, because anytime you upgrade your filters to a higher level of filtration, it's harder to draw air through it. And so you may have, you know, shortages in air changes and other problems. And so really looking at that from a holistic standpoint, it's a great approach. So lastly, looking at furniture, you know, again, healthcare design furniture has come a long way in the past 5 years. Or actually 10 years. It's no longer a lot of green vinyls and, you know, institutional looking furniture. You're able to get highly cleanable surfaces. And again, it's not about necessarily preventing COVID, it's about being able to clean these spaces. So we still need to have places for elderly and people who have difficulty or mobility issues coming to these buildings and coming back to the workforce, who may be waiting for a taxi or their Uber, and providing those places for them to sit and rest while they're waiting. But obviously we're reducing that quantity to maintain the physical distancing, but also looking to be able to provide furniture that is very easy to clean. And so that we're not investing a lot of time of the building cleaners having to, clean furniture that is more difficult. That includes, the floor is a big component of that, being especially a lot of carpet and seating areas to reduce acoustics. Getting in there and being able to clean those around the furniture without having to do an exhaustive moving of furniture is important, kind of keeping those processes. The easier it is to clean, the better job the cleaners are going to do keeping it safer.
Awesome. Oh, we're going to talk about the resources. Okay.
Yeah, this is just a quick slide, and like we said earlier, we're going to distribute this to people. Here's just a lot of good examples of, I know there's a lot of information out there, and everyone's trying to find some of the best resources and to be able to put into use. And so we will distribute this to people so you have it.
I did want to give a shout out to our friends at BOMA Boston. I'm on their emergency preparedness committee relative to COVID. So they have some great resources. They have some great companies that are affiliated with BOMA that, are available to be engaged, that are experts in like cleaning and bringing, the next level of cleaning and understanding the risks and how you kind of prepare for those things. So definitely encourage people to reach out to them as a resource and a great institution working to help make this as safe as possible.
So gentlemen, it looks like we have another question. In short term and returning to offices, are there potential conflicts with accessibility spatial requirements, both universal design and code required? And will the pandemic create inequality issues, or is this being reviewed in whole?
I can answer the ADA question. I don't know if you, Tim, if you have thoughts on it, but it depends on how people change their buildings. So, we've taken an approach that there's very little physical changes that we're making to our office to accommodate COVID-19. We're really going about it with the reduction of people in the office. And so all of our, building accessibility, office accessibility, access to the amenities and, toilet rooms and water and things like that are all remaining unchanged. So there's that aspect. I think the socioeconomic aspect is the bigger problem. COVID-19 has been shown to really dramatically impact lower income workers at a far significant higher rate. And so, we talked about this with bringing people back. We're actually a little bit late. I mean, we waited a week. We talked about waiting longer because there is, people that need to get to their job to get paid. We're fortunate enough to be able to remotely work and remain productive. But again, those service workers, those people that are at the front lines rely on the MBTA to get to their office, and anything that we can do to further kind of continue to work from home and allow those public transportation resources to be available for people who have no other option was definitely a part of our decision making and kind of like looking at it from a socioeconomic standpoint.
Yeah, it is going to be interesting to see moving forward for new projects, how the code might change and how, organizations like the USGBC with LEED and well building standards, all those things might, be changed in the future to accommodate for more of this, COVID preparedness.
And gentlemen, from the founder of High Profile, something specific to High Profile and related to microbial services, publications like ours are often distributed throughout the office. One paper on average reaches 3 readers. So sometimes passed hand to hand, sometimes distributed through a cart system. With home working, we've seen a surge in digital readership, but how might post-COVID handle the distribution of publications within the office? Do you see a change?
Yeah, I mean, I think there is going to be a change with all the, stuff. And I know a lot of clients, that, before COVID, we're talking about, do you have assigned workspace or do you have unassigned workspace? A lot of people are talking about that now because those people that have, unassigned workspace, essentially can do a deep clean every night, and there aren't those things kind of laying around like publications and things of that nature. So I think people are going to, try to minimize a lot of that stuff that can be handed from one person to another. From one example is, kitchen utensils are all, for the time being, are going to be all disposable. So there's not even a chance that someone could share something that's, contaminated.
Right.
I guess I'll take the counterpoint on that. I'll play the devil's advocate on that one, Tim.
Yeah, please.
I think it's interesting, and I think, time will tell. I think there hasn't been a big concern on mail. I mean, there's been talk about it, but there hasn't been like a instance where a significant outbreak of COVID was like somebody at the mail department or post office got sick and ended up spreading that through, paper or cardboard boxes and things like that. Recently, USA Today had an article from CDC that, they were questioning the efficacy of surface transmission. Again, I'm not going to change my personal behaviors based on that. Still kind of worried about that. But, as the research, more COVID particles are available and the research develops, I think we'll get that. And, it'll change it, but I don't think it's a long-term change. I'm still a paper guy. I like to have my paper. I sit there and still read a paper. So
Love to hear that. Guys, thank you so much for this. This was really informative, and I know you're excited to play Odd Man Out.
Love it. Can't wait.
Okay, so the way we play this game is I'm going to make statements that are true based around post-COVID-19 workspace, and one of the statements will not be true. It is the odd man out, and you are to choose what that is. And if you win, you will get, and Susan Shelby, I know, is listening, you will get the digital download of the latest album from Fiona Apple called Fetch the Bolt Cutters. Okay, here we go. What is the odd man out? Security desks should have transparent shields and queuing to be spaced 6 feet apart. Corridors and stairs are to be marked one way wherever possible. Conference and meeting spaces should be supplied with alcohol and chocolate cake to ensure employees and clients are not only safe but fed well. And bathroom doors should swing out if possible, or be provided with adjacent disposable receptacles for soiled hand towels. What is the odd man out?
I wish the chocolate cake one were true.
I want it to be true, though.
That's right. Conference spaces do not need to be supplied with alcohol and chocolate cake. However, I heard from your higher ups that they hear you and they're on that.
I know Mel does a great job managing our office, so I can see her right now making sure there's chocolate cake for me tomorrow in the main conference room for her.
I'm going to say, gentlemen, thank you so much. Tim Bailey and Jason Costello of Margulies Perruzzi. This has been awesome, and have a wonderful afternoon. Thanks everybody for attending HP Connects. Bye-bye.
Thanks, Anastasia.
Thank you.
Thanks, guys.